In order to determine if post-traumatic amnesia, which is also known as PTA, is caused by drugs that have been administered after an injury, this study aims to examine the role of potential pharmacological and psychological co-founders of the assessment of PTA in patients that have not sustained a traumatic brain injury. Within the study, those without TBI, traumatic brain injury, are observed along with other variables that will play a role as a contributing factor. These will include demographics and psychological variables. The analysis of reach methodology in this study is in two phases. Um, there are 63 orthopedic participants out of 186 that agreed to participate. 45 are females and 18 males, none which have experienced a brain injury, and all are patients of the IC's General Infirmary. There is no evidence that any of the participants having a traumatic brain injury, data of all the medications taken, demographics, and psychological data are collected during the first phase of the study. During the second phase, there are follow-up interviews of psychological data on mood and post-traumatic stress disorder, which is assessed by the Rivermead PTA model in 47 of the patients. Any of the participants that had sustained head injuries or likely to sustain or are likely to report any dizziness, confusion, or loss of consciousness were excluded from the study. In this study, there are some dependent variables that exist. One is sedative hypnotics, antipsychotics, and anticholinics. In patients who have not suffered brain injuries, there is still evidence that opioids affect the accuracy of post traumatic amnesia. In this case, it's plausible that at least in some cases, PTA can be drug induced. Study results of this show that 38% of the patients with non-brain injuries reported post-traumatic amnesia like phenomenon. They received opioids, and the surgeries and medications included benzos early in their admission, and they met the cutoff of anxiety, which are the greater predictors of post-traumatic amnesia like phenomenons. These things were observed. The findings of the study help explain the discrepancy between the methods of assessing the severity of the brain injury. Uh, Surgical procedures and administering of anesthetics to patients whose clinical levels of anxiety within a short period of an injury contributed also to amnesia that amounts to a post-traumatic like phenomenon. The number of the participants, though, in this study is awfully small to have a really conclusive evidence that the administering of drugs in a hospital setting following an injury are responsible or cause for post-traumatic amnesia. Of course, there's always that possibility. I mean, if you look at the number of patients that fall under these circumstances, there should be a larger participation pool to get better results. Possibly dividing the participants also into different age groups instead of an average age, because you have to consider that age can make a difference in how the effects of the drugs um, will affect them, especially being opiates or benzos. Um, having all the participants assessed for PTSD, anxiety, and depression, I think that's an excellent idea. And the tools that they used, um, the IES, um, it's had some satisfactory benefits, and it also has been criticized for overestimating the symptoms of PTSD. In conclusion of this study, the hypothesis of the study that some cases of post-traumatic amnesia being drug induced. There is enough data to question whether or not the post-traumatic amnesia duration assessed by the most commonly used methods question can be confounded by drug effects. Clinically, though, the best way to measure is via retrospective questioning that leads us to believe that the use of drugs could mimic post traumatic amnesia. In addition to the drugs, it is important to take into account those psychological co-founders such as post traumatic stress disorder. The drugs that have amnesia effects have been known to induce anterograde amnesia, which is dependent of sedation. Benzos have been studied, and the findings are consistent with inducing anterograde amnesia. There are less reliable drugs that can cause those effects as well, and those are the sedative, hypnotics, and some antipsychotics.